Good afternoon. Today we are going to discuss about frontal bone. So at the end of the class, you should be able to identify the bone and also understand the anatomical position of the bone and the parts and structure features of the bone and also structures, anatomical structures related to the bone. So frontal bone, it is situated, it's a part of the skull bone and it is situated anterior part of your skull, and the shape of the bone is, it's a cockshell shaped bone and it's a flat pneumatic bone. What is flat pneumatic bone? So the bone, it's a type of bone. So it's a flat bone, that means the shape of the bone is flat, and it's a pneumatic bone, means inside the bone there are air spaces called as air sinuses. So inside the frontal bone you have frontal air sinuses, which is situated behind your superciliary arches. We will see what is superciliary arches. So it has three parts. The large anterior part present here, this is the squamous part, and the part forming the roof of the orbit, that is called as the orbital part, and also the part which extend towards the nose or towards the nasal bones, this is the nasal part. So how to keep, what is the anatomical position of the bone? The squamous part should be convex and vertically downwards. The orbital plates, okay, the orbital part should be horizontal and backwards, and the nasal part, which is present in between the orbital part, it should be vertically downwards and forwards. So this is the anatomical position of the bone, where the squamous part should be convex and it should be vertical. The orbital part should be horizontal and backwards, and the nasal part should be downwards and forwards. So this is the anatomical position of the bone. Now we will see each part separately. So each part, the squamous part has, it is the largest part. So this surface is the external surface. It has two surfaces. This is external surface, and the surface here which is facing the cerebrum, this is the internal surface. It has two borders. This is one border, this is called as the posterior border, parietal border, which articulates with the parietal bones, and here is another border, this is called as supraorbital margin, which separates the squamous part from the orbital plates. And it also has a pair of sinuses, as we said, frontal sinus. Coming to the first we will discuss about the supraorbital margin and the external surface of the squamous part. So the supraorbital margin, it is concave and it separates the squamous part from the orbital part of the frontal bone, that is it forms the roof of the orbit. So the supraorbital margin, medially it is rounded and laterally it is more sharp. So at the junction of the medial 1/3 and lateral 2/3, there we can see a foramen, that is called as supraorbital foramen or notch. So through this transmits the supraorbital vessels and nerves. So through this orbital foramen, supraorbital vessels and nerves are passing. So if you come more laterally, the supraorbital margin, it forms a notch. So this is called as a process. This is called as the zygomatic process of frontal bone. It articulates with the frontal process of zygomatic bone and form a frontozygomatic suture. So here, this is the frontal zygomatic process of frontal bone, and this is the frontal process of zygomatic bone, and here is a suture. Now if you see posteriorly, starting from the zygomatic process of the frontal bone, there is a line. This is called as superior from starting from this frontal process or zygomatic process of the frontal bone, posteriorly we can see a line, that is the temporal line. So temporal line, when it moves posteriorly near the parietal bone, it divides into superior and inferior temporal lines. So the part of temporal, the area below this temporal line in the frontal bone, this is called as the temporal surface, and there is the attachment of temporalis muscle. So here in this image we can see clearly this is a temporal line which goes posteriorly, and the area below this temporal line in the frontal bone is called as temporal surface, and it has attachment of temporalis muscle. Okay. Now coming to the external surface, if you see the external surface is smooth and it is related to the temporalis muscle. Here we have the temporalis muscle and also the aponeurosis of scalp, which is a third layer of scalp. Then above the supraorbital margin we have a rounded elevation. Here this rounded elevation is called as superciliary arch. So medially the superciliary arches meet, and at the center we have an elevation, and that elevation is called as glabella. So glabella, how the name came is, we know that our eyebrows are situated above the superciliary arch, and middle part we don't have hair. So the area which is glabrous, that means there is no hair, that is how the name came, glabella. So if we move upward, we have two tubers here or elevation process. So that is called as frontal tuber or frontal eminence. So the peculiarity of frontal eminence is that is the primary ossification center for the frontal bone. So the ossification starts at the frontal tuber. So what is metopic suture? As I said, when forming this frontal bones, they are formed on both sides. So here there is one frontal tuber, one bone will begin here, the other bone will begin here. At the center there is a suture. Okay. Later around by 2 years, these two bones fuse together and form a single bone. But in some individuals, around 3 to 8% of individuals, the suture remains there, and that is called as metopic suture. Not seen in everyone, only in around 3 to 8% of individuals. These two bones are seen separately, or you can see a part of suture there. That suture is called as metopic suture. Coming to the internal surface of the squamous part, so it's deeply concave and it forms the part of anterior cranial fossa. So the cranial fossa is divided into anterior, middle and posterior. The anterior cranial fossa is formed by the squamous part of ethmoid bone, squamous part of the frontal bone. So here in the inner surface we can see many impressions. They are the impressions of the gyri of the frontal lobe of your cerebrum, and also we can see impressions of meningeal vessels and nerves. Here we can see the gyri impression and also meningeal vessels impressions. So here in this we can also see the impression of sagittal sulcus. Can you see, this is the superior sagittal sinus. So here the frontal bone has a sulcus which has the superior sagittal sinus, and this sulcus is called as sagittal sulcus. Anteriorly the sagittal sulcus fuse and it forms a crust, and this is called as frontal crust. So this superior sagittal sulcus as well as the frontal crust gives attachment to the falx cerebri. It's a extension of the dura mater, and anteriorly it goes and attached to the frontal crust as well as the sagittal sulcus. Then at the junction of near the frontal crust, and here we can see the cribriform plate of ethmoid, we can see a small foramen that is called as foramen cecum. So usually in most of the individuals this foramen cecum is not pass, any significant structures are passing through the foramen cecum, but in few individuals emissary vein which connecting the superior sagittal sinus to the nasal veins can pass through this foramen cecum. In case of high intracranial pressure, what happens, there will be epistaxis. So this foramen emissary vein which passing through the foramen cecum can act as a safety valve. Coming to the next part, that is the parietal margin. So the parietal margin which articulates with the parietal bones at coronal suture. Laterally there is a rough surface which articulates with the sphenoid bone, greater wing of sphenoid bone. So here it articulates with the parietal bones forming coronal suture, and also articulates laterally, it articulates with the greater wing of sphenoid. Next, coming to the nasal part. So here is the nasal part. So between the two orbital plate, the nasal part extends downwards towards the nasal bone. So the lower part of the nasal part is has a very rough surface. It articulates with three bones. Here we can see this is a lower part that is called as, this rough part of the lower part of the nasal part is called as nasal notch. So the nasal notch here, it articulates with three bones. Here we can see this is the nasal bone, and this is the frontal process of maxilla, and here we can see the lacrimal bone. So the nasal notch articulates with these three bones. Now at the junction of these nasal part and the two nasal bone forms a point called as nasion. Now extending from the nasal notch downward, there is a triangular process. So here we can see the triangular process that is called as nasal spine. So this nasal spine, it forms a part of the nasal septum, and anteriorly it articulates. So this is the anterior part, it articulates with the nasal bones, and posteriorly here it articulates with the ethmoid bone. So both sides of the nasal spine, you can see a curved surface that forms the roof of nasal cavity. Coming to the orbital part, as I said, orbital part forms the roof of your orbit. It is directed transversely backwards. So it has two surfaces. The surface which forms the roof of orbit is called as the orbital surface. The surface which lies inside, which is facing the cerebrum, is called as a cerebral surface. And in the orbital surface, if you see more laterally, there is a depression. So this depression is called as lacrimal fossa. Here we can see the lacrimal orbital part of the lacrimal gland is situated in this depression present laterally, and medially you have a spine that's called as trochlear spine. So here we can see in this trochlear spine a connective this is present, so that your superior oblique muscle passes through this pulley. So in the trochlear spine a fibrocartilaginous pulley is present. The superior oblique muscle, it takes origin, it passes through this pulley and then move to its insertion. And also between the two orbital part we can see a notch, and this is the ethmoidal notch where the ethmoid bone can be seen. Coming to the orbital part again we can see impressions of gyri and also impressions of meningeal vessels. That's about the cerebral surface, and the posterior margin of the orbital surface. The posterior margin, medially it articulates with the lesser wing of sphenoid, and laterally it articulates with the greater wing of sphenoid. And the medial margin, here we can see the medial margin articulates with the, here is a cribriform plate of ethmoid, and anteriorly and posteriorly here we can see one canal, and here we can see one canal. So this is the anterior ethmoid canal and this is the posterior ethmoid canal. Through that anterior ethmoidal artery, and through anterior ethmoid canal, anterior ethmoidal artery, vein and nerves are passing. Same way through posterior ethmoid canal, posterior ethmoidal vessels and nerves are passing. Coming to the sinus present in the frontal bone. So here we can see this is the frontal sinus which is present in the frontal bone. It's triangular in shape. It situated behind the superciliary arches, and also it extends upwards and backwards. So frontal sinus is absent at birth. It gradually, or absent or rudimentary at birth, and then it gradually develops. By 7 to 8 years it develops. And the frontal sinus on both sides, they are separated by a bone in the center, and it's not exactly in the center, it is deviated to one side. Now the frontal sinus, where it opens in the middle meatus. So this is the lateral wall of the nasal cavity, and here we can, in the middle meatus you can see a semilunar sulcus or groove, and anterior part of this semilunar sulcus is called as hiatus semilunaris. So the anterior part of hiatus semilunaris, you have the opening of frontonasal duct, that is the opening of frontal sinus. So through frontonasal duct, the frontal sinus opens into the anterior part of hiatus semilunaris, which is present in the middle meatus. So ossification, frontal bone is ossified in membrane. So the primary center of ossification we have already discussed. It is the frontal tuber. On both sides it starts ossifying by 8th week of intrauterine life, and at birth, as we already said, the two parts or the two bones are separated by a metopic suture, and it is replaced by bone by 2 years, but only in few individuals, around 3 to 8%, the metopic suture persists throughout life. And the secondary center of the ossification is present at the nasal spine by 10 years. So today we discussed about the frontal bone. How is the anatomical position of the bone? It has 3 parts. The squamous part should be vertical, it is convex and vertical, and the orbital part, here is the squamous part, it should be convex and vertical. This is the orbital part, it should be transverse and backwards, and the nasal part should be downwards. So the squamous part has 2 surfaces. This is the external surface and the internal surface, and we have a supraorbital margin which separates the squamous part from the orbital part. And we have seen many significant features present in the frontal bone. Thank you.